More precise, customized from patient to patient, and a speedy now using robots designed specifically for knee replacements. Health editor Dr. Maria Simbra has more on the cutting-edge technology.
Scott Kramer loves to garden and walk, but about 7 years ago he noticed something was wrong with his right knee, especially going downhill.
It just hurt. I didn't know what was wrong. It just felt like an ache, a solid ache, and I just couldn't get rid of it. And eventually I quit walking. I just couldn't do it.
He tried a brace and shots, but these only worked temporarily. When it got to bone on bone along the inner part of the joint, his doctor got right to the point.
I was expecting with Dr. Chu to give me an injection like cortisone or something, and when she walked in, she goes, "You need a new knee," which is not very subtle, but it was shocking.
Scott was only in his 50s, so his surgeon opted for a partial knee replacement with the surgery performed by a robot.
My first thought was, I'm not having a machine cut me open.
Turns out the surgeon still controls the operation, but the robot carries out very precise preoperative plans based on the patient's own MRI scans and GPS navigation.
We not only feed it a 3D model and then add navigation on top of it, but then we use a robot to make sure that we're executing that plan to perfection.
If the surgeon goes off course, the robot shuts down and stops cutting.
Its job is to make sure within, less than a millimeter and within a degree that what we planned for is exactly what we end up with.
It just gave me confidence that he would make a mistake. Like he's not going to drill in the wrong spot or cut in the wrong spot. You only get one chance at doing this.
Overweight patients and patients younger than 50 are not the best candidates. A rare complication is infection at the site of the navigation pins that are placed in the bones above and below the knee for the procedure. Though among a small number of early adopters, the overall complication rate is only 0.4% compared to 4% across thousands done the regular way.
It's one procedure that we think has a lot of benefit and has been sparsely used.
Sparsely used because it's an expensive piece of equipment for a hospital. In fact, Scott had to go to West Penn, even though AGH would have been closer.
I was doing the robot. I didn't care where it was.
Scott's surgery was in April. He was up to his old activities shortly thereafter.
And I actually planted all my plants 3 weeks after my surgery.
I'm Dr. Maria Simbra, KDKA-TV News.